Hi everyone. In this video on acupuncture and fascial lines, I want to introduce you to 4 key terms that will help you to understand how to assess people's structure. And I feel like this is a really important thing for acupuncturists to understand because a lot of us probably didn't get that in our training. And once you start to look at things from a structural perspective, it helps you to much better understand acupuncture in general, as well as how to get more optimum results when treating things like headaches and neck pain and back pain, as well as spinal conditions and hip pain, pelvic conditions. You can use this for, as well as conditions of the knees and the musculoskeletal system in general. But understanding this will also take you to a much deeper understanding of the meridians and the myofascial lines, as well as point actions and indications and Master Dong's points as well. So the 4 key terms that we need to understand are tilt, bend, rotation, and shift. So a tilt is a lean to one side in the body that makes one side higher than the other. So for example, head tilts or shoulder tilts are quite common. And if we look at this picture here, we can see that this guy's right shoulder is much lower than his left shoulder. Okay, so that's a very obvious shoulder tilt as well. And notice how his head is tilted as well. And you can have clients who have only a head tilt, but not necessarily a shoulder tilt. Or you can have clients that have a shoulder tilt and a hip tilt together. And a lot of times those will go together because of the hip and shoulder connection. And we can see in this myofascial line here, this back functional line, it demonstrates some things about the shoulder and hip connection. Now, I'm not going to speak about that much right now because I've got another video on that, and that's something that I go into detail in the courses. So something to look for then are the tilts, and you can see this every day in clinic. You can observe tilts very frequently. They're very common to see. And once you start recognizing them and then relating that to the meridians and to the fascial lines, then it's going to just help you all around in so many ways. Okay, the next term is bend, and a bend is a series of tilts that results in a curve, and it's usually applied to the spine, and this also relates to scoliosis. Now, I'm not going to go into this a whole lot right now. What I do want to talk more about, though, are shifts and rotations, okay? So in a rotation refers to the circular plane. So a rotation of a structure in a circular plane. So if you take your head and look to the left or look to the right, then that's a rotational movement. And we also rotate around the spine, we can rotate around the shoulders, we can rotate around various joints. Now, if you look at this picture here in the center, this guy has a slight right head rotation going on. So notice how his head is rotating slightly to the right side. And it looks like there might even be a shoulder rotation going on right there too, because this shoulder looks more forward than this shoulder here in the back. Okay, and here's an example of a tilt again. So a tilt leans to one side, but a rotation occurs around a circular movement. Now, the last term that I want to introduce you to here is a shift. And this is a general term for displacements from the center of gravity. Okay, so let's just look at a picture to see the most straightforward example. Right here, this shows an anterior forward shift of the head. So the spine is a center of gravity, or the torso, we can think of that as a center of gravity. But in the case of shifts, there is this displacement either forward or backward, or it can occur in different directions. But here we see a very common pattern being an anterior forward shift. Now let me show you another example of that from an actual case study. Here we have an anterior shift as well. Now she's not looking down, but notice how her ear is in front of her shoulder, whereas the shoulder and ear should really line up. Now this client, her main concern was neck and shoulder pain, and a lot of that was due to the shift that was occurring. Now, we can relate this to traditional Zong Fu patterns, and In our traditional teachings, we speak of liver qi stagnation and B syndrome and kidney deficiency and the way that these relate to various conditions, but that only takes us so far. And if you want to rapidly accelerate your ability to treat spinal pain and neck pain and headaches and neck problems and hip problems, then it's really essential to understand these structural dynamics, because a lot of other doctors, physical therapists and osteopaths and conventional doctors are aware of this and they're using this, and some of them are even using acupuncture and they understand how to use this as well. So really essential that we get this under our belt and start applying it to our assessments and understanding how that relates to traditional points as well as to Master Dong's points as well. Now here we can see some other things. Here's a very common thing that's happening in today's world are these anterior head shifts like we saw in this picture here. Now this will result from looking into computer screens, from sitting. It results from looking at phones excessively, and this can occur not only in the head, as we see in this picture of this guy seated here, but we can also see how this can occur within the spine. So this guy's whole spine is shifted forward, and this client here, he also had that as well. And that's why I've put this little stick figure here, is because he demonstrated an anterior shift in his whole torso. And that was related to his lumbar pain and his shoulder pain, as well as the knee pain. So we worked that out, and he was very happy with the results. And I go into great detail in my 212 class on the neck and upper back in this course, and we describe that and what points I used and everything. So here's some other examples. This guy's got an anterior head shift as well. And then over here, we see a posterior shift. And then here we see lordosis and kyphosis. And then this woman has an anterior shift as well. So if you want to learn about these things, especially how it relates to the head, neck, and the upper back, as well as the lower back, I do talk about the lower back a bit in my 212 course. I would suggest checking that out, okay? Applying these fundamentals of assessing structure, such as tilt and bends and rotations, it also applies to the hip. And this is what I cover extensively in my 214 class on the hips and pelvis. So one thing that's quite common to see in people is what's called an anterior pelvic tilt. And this is what happens is the pelvis will tilt forward, and that's going to cause contraction in some muscles and over lengthening in other muscles. Now, a posterior tilt can also occur, and here we see an x-ray with someone that has this flat back and a posterior tilt occurring as well. And both of these patterns can lead to low back and hip pain, but you need to learn to treat it in different ways because the movement of the pelvis and the tilts are different in each case. Now let's take another look at a lateral tilt. So here in this x-ray, we see a lateral tilt, and you can see this red line that I've drawn here, and this side is lower. So if you're not checking for anterior and posterior and lateral pelvic tilts in your clients with back pain or hip pain, then there's a major piece of information that is missing from your assessment. So I cover this in extensive detail in my class, the 214 class. And then I also go into a lot of other things as well about like how this relates to the myofascial lines, how a lateral pelvic tilt relates to the lateral line or the gallbladder. We talk about specific muscles. Here you see the QL or the quadratus lumborum. We talk about how that can get involved. And then I also go into extensive information about the anatomy. So we talk about the hip external rotators. We talk about external rotation and how that can relate to groin pain. We talk about the hip adductors and internal rotation and the way that this can cause pain in different areas. So this is all really essential to understand, and the way that this relates to both the meridians and the myofascial lines. I also cover in this course traditional points that we use for hip pain and why they work in the way that they do and why they get great results sometimes, but Other times they don't get results. I also go into Master Dong's points and we compare the traditional points with Master Dong's points. And because the hip is such a complex joint, because we've got the spine and the sacrum joining into the pelvis, and then we've got the femur, it's a very complex joint. And it's really essential to understand how these different myofascial lines relate to the meridians and how that relates to using different points. Okay, so I know a lot of you are probably struggling with getting adequate or great results when treating the hip, and I've developed this course to help out with that. It's also going to teach you how to treat the low back as well because of that junction that occurs there. So check that out. You're going to be happy you did. I go into some research that's been done for osteoarthritis of the hip. We talk about hip pain and differential diagnosis from a Western perspective, but I also bring that back to our traditional treatment methods and our traditional points, as well as the Master Dong's points. There's a whole system that I've developed for getting great results for the hip pain. I also cover some movements that you can have your clients do when you do distal needling. So if you're putting needles in their hands or in their shoulder or wherever you're putting needles that aren't local, if you're doing distal needling and then having your client do a series of movements that are specifically targeted for the different myofascial lines and for the different functional groups, the functional muscle groups, and for the meridians, when you start adding movements to your distal needling practices, you're going to see much better results. So that's the 214 class, and I've currently got a special going on for the 212 and 214 class. That's going to give you a wide overview and a strong foundation for being able to assess structural conditions. So check that out, and that's all for now.